Hi friends, I'm Dr. Neeta Ratty from Vital Clinic, New Delhi, India. Let's bring science to beauty. Now we here in Vital Clinic, we handle all the corrective cosmetic surgeries which include male breast. Male breast could be like just prominence of the nipples, or it could be swelling which is mostly because of mammary glands. Then it could be fat, which is stubborn fat, which does not go in spite of doing exercises, or it could be like fat deposits in the axillary area where they get encapsulated and it looks like a small tumor or a lump, which is a lipoma. Then it could be like any problem in the nose shape, like if it is too broad, you want to make it narrow, or you need to do a face which is a drooping face, you need a face lifting or a brow lift, or maybe just the jaw lift, or maybe the neck lift, or if there is some looseness in the neck, maybe the platysma tightening, or one needs some little touch ups like Botox, which paralyzes the muscles so you don't see the crow's feet, or it could be some fillers if you have some under eye tear tufts, or some areas or some depressions, scars are more prominent and one doesn't like them. It can be done with filled with fillers, but the Botox and fillers are temporary procedures. But if somebody wants a permanent face correction, like to good contouring, get the lines, fine lines and wrinkles almost erased, then in that case one should do a reform CRF session 3 hours in one go and followed by the Mel Block home kit. The second, the third which procedure which we do, then there is breast implant, right? Whether it is to increase the size of the breast or take up the little sag which is there. Then there is a breast lift for a sagging breast, where you need to actually bring a good shape and firmness in the breast. Or it could be like arms lift. If the arms has a loose hanging fold, then you need a brachioplasty or an arm lift. Then there is thigh lift. Then there is abdominal fat reduction. So like certain areas, of course, by exercising, dieting, one can lose weight, which gives you a generalized weight reduction or inches reduction. But if you are still certain areas are more prominent than the others, then those are the areas which are ideal for removing fat permanently by liposuction. We do here by the tumescent awake technique, which most people are not doing, because and it has multiple advantages when we talk of the patient or the person who is getting it done. The advantages are that it is done under local anesthesia, so you don't have to get admitted. There is no need for anesthetizing the patient completely. So there is no risk of any vomiting or nausea or feeling of sickness after the procedure. And the area is completely bloodless. So there is hardly any blood loss. So that's a very big advantage. And since the area is almost virtually bloodless, you don't need very big cuts to do the procedure. Which, if a person is bleeding, you need bigger cuts. So when we do the procedure by the tumescent awake technique, normally the cuts are very small and there is practically no bruising. And at the same time, since it's bloodless, your stitching or the scar tissue is very, very minimal and the cuts are almost not visible. So these are the different advantages. And you go home walking, you don't have to rest at all because there's no bleeding, so there's no weakness. And very minimal pain, which can be handled with a simple painkiller. So these are different corrective procedures which we can do. Or the ear, when some people have ear like this coming forward, so to take it back, right? Or if some lips enhancement is required, or if some correction is required as far as your contouring is concerned. So all those procedures are cosmetic corrective procedures. Some are surgical, some are non-surgical. So it depends person to person what is required. That is done here at the Vital Clinic. Next time I'll be talking about hyperpigmentation, which we do at Mel Block Center, which I will talk in the next video. Thank you so much.